The aim of this video is to show you how to provide care for patients with a dry mouth. Having a dry mouth is a common symptom for many patients in hospital and can impact on quality of life. Patients may complain of a very sore mouth, and this may mean they have difficulty opening their mouths, cleaning their mouths, eating, drinking and speaking, and wearing their dentures. As a result, dry mouths can affect overall recovery. There are many causes of dry mouth: dehydration, side effect of many medications, mouth breathing, head and neck radiotherapy, chemotherapy, oxygen use, being nil by mouth, systemic conditions such as Sjogren's disease. Signs of a dry mouth include frothy or stringy, dried, tenacious, sticky saliva, absence of saliva, food debris sticking to the teeth or the palate, dry, crusted and cracked lips, a red, smooth, shiny tongue. So, how should you care for a dry mouth? Although chewing sugar-free gum or sucking on sugar-free sweets may stimulate saliva production, these means may not be suitable for all inpatients. Dry mouth care aims to make the mouth clean and comfortable. Firstly, if the patient is able to take frequent sips of cold water, this will help to keep the mouth moist. If there are concerns about swallowing, you should check with their speech and language therapist. Water-based mouth moisturising gels can be useful for some patients, as they contain products to keep the mouth moist for longer. The gels can be applied to all parts of the mouth, including the lips, tongue, and cheeks, and should be slowly massaged into the tissues, as if you were massaging a cream to treat dry skin. Gels can be applied with fingers, or a small-headed toothbrush, or mouth-ease cleanser. It's important that gels are massaged into the mouth, as otherwise they'll make the mouth feel stickier and leave a further layer of secretions. For patients with dried saliva secretions, the gels can be massaged in and left for 5 to 10 minutes before attempting to remove the secretions. Dried secretions, once softened, can be removed either with a toothbrush or mouth-ease oral cleanser. Careful oral Yankauer suctioning is often useful. The mouth-ease stick should be held between the thumb and the forefinger, using a rotating action to engage the secretions. Mouth Care Matters does not advocate the routine use of foam-ended products for mouth care. They're not effective at removing dental plaque and can be a potential risk if a patient bites down or the foam head detaches. There's no substitute to foam products, but a good alternative is a small-headed toothbrush that can be dipped in water. In 2012, the Medicines and Healthcare Regulations Agency, MHRA, published a medical device alert on the safety of oral swabs with a foam head and the risk of choking. Although foam swabs are designed to be single-use and disposed of immediately, they've commonly been found to sit in glasses of water or other liquid around the patient's bed. Dry mouth care should be carried out regularly. For some patients, this can mean every 2 hours. You can show families how to provide mouth care. This can be really comforting for patients at the end of their life. Dry mouth care can make a big difference to the quality of life of inpatients.